Speaking on the next topic, we have Dr. Nilanjan Kaushik Thakur, who will be speaking on hydrodissection in eyes with shallow anterior chamber. Dr. Thakur is a very dynamic surgeon and a very good teacher who is working presently at Silchar Medical College and Hospital, Assam. Over to you, Dr. Thakur, for your presentation.
Thank you so much, Dr. Jayashree. Good morning, everyone. So slides will be repetition of my previous speaker. So it's a hydrodissection in eyes with shallow anterior chamber. So we all know it's a challenge during the cataract surgery, and it already reduces the tight confines which we get while doing the surgery in the anterior chamber if it is a shallow anterior chamber. Now we should also know that the two most important structures in a cataract surgery are the corneal endothelium and the posterior lens capsule. Now these are subjected to irreparable damage if there is fluid imbalance in the anterior chamber. So techniques to deepen the anterior chamber during cataract surgery would provide a wider margin of safety and it helps to ensure an excellent visual outcomes. So before going for the surgery, we should know the risk factors first. So what are the risk factors? So it's a demographic factors are very important, but in Asian populations, like in Northeastern some population, we get smaller eyes. In patients with hypermetropia, in patients where there is weakness of the zonules, which will cause the iris lens diaphragm to come forward, okay, and in small eyeballs. So you should be beforehand, you should be careful that these patients might have a shallow anterior chamber. Now, what are the intraoperative clauses? Now, if you are doing the surgery under peribulbar block, be careful about retrobulbar hemorrhage. Now, in some cases, there will be zonular disruptions, and this will allow the fluid to go into the posterior segment. So it will act like a one-way valve. So in patients with pseudoexfoliation syndrome, history of ocular trauma, in Marfan's, in posterior capsular rupture, you should be very careful beforehand that this patient will have problem. You will have problem during surgery. So during surgery, what are the causes that causes the shallowing of the anterior chamber? Number one, as my previous speaker said, there is excessive fluid is going out from the anterior chamber. It's through the main wound or from the paracentesis. Number two, you have put a very high flow setting in the phaco machine, or there is insufficient, less fluid is coming inside the anterior chamber, or the bottle height. As my previous speaker said, the bottle height. So these things you should be kept in the mind. Now another important point is the positive pressure. So positive pressure may develop. Sometimes you are putting the speculum very tight or the drape very tight. So you have to look into those matters also. Now, proper pre-operative evaluation. In the slit lamp, you can do the grading of the anterior chamber by Van Herrick's method. And when you're doing a biometry with a scan, that will give you the anterior chamber depth. So then you can come to know, okay, that patient will have a shallow anterior chamber. Plus, you can do an OCT anterior segment or an ultrasound of the anterior segment. Now, what are the management strategies you like to do before proceeding for hydrodissection? Now, if you feel that you want to decrease the vitreous volume, you can use mannitol. You have to see the other parameters like BP and all you should see first check before giving mannitol. Now, if you want to decrease the aqueous volume, you can go for oral acetazolamide tablets. Now, if you are doing under peribulbar block, make sure that you give a very good block, because a good block will have a very good ocular echinacea, and that will decrease the chance of pressure from the eye muscles. Number two, avoid large volumes of local anesthesia, because that will increase the intraocular pressure and it will complicate your scenario. Now, a good ocular massaging is very important because this will reduce the orbital volume, okay? And just minimize the pressure, external pressure, like the drape, the speculum, tight speculum, and your handling should be gentle. Now, if your paracentesis wound is leaking excessively, give a suture over there. If your inflow is insufficient, see the sleeve, or you can enlarge the incision. Now, if your bottle height is inadequate, raise the bottle height. But see, if you raise the bottle height, the pressure is more, the patient will complain of pain. Okay, so you can decrease the flow rate. Now, if you have eliminated the above causes and still the chamber is shallow, you can see with your finger the tightness, then you have to rule out other causes. You can use high viscoelastic substances to create and maintain spaces. Now, coming to the hydrodissection proper. Now, performing a hydrodissection is difficult in the anterior chamber because due to the poor maneuverability, continuous collapsing angle, and it can be further complicated if the intraocular pressure is rising or there is iris prolapse from the wound sides. Now, what are the important tips to keep in mind during hydrodissection? Number one is the placement of the cannula. The cannula should not be over the capsule. It should be beneath the capsule and you should tent it. Okay, this is very, very important. Now, if you are injecting fluid over the capsule, if your zonules are weaker, sometimes it acts like a one-way valve where the fluid will go into the posterior segment and that will collapse the chamber further. So this is a condition. So immediately you have to give mannitols or you have to manage it. So there you have to be very careful. Now, amount of fluid and the intensity of fluid, it should be in a controlled fashion and slow. And important thing is that you should see that there is no air in the syringe. Okay, sometimes you put air is there before hydrodissection, just you push, air will go inside, so that will cause PCR. Now, you have done a small capsular rhexis. You have to be very careful because once you inject fluid over here, it will push the nucleus upward and it will cause anterior capsular block. So here you have to then tap on the nucleus and the amount of fluid injected. Because if it is a small capsular rhexis, fluid will collect there. If the amount of fluid is more, it will, then the PCR will occur. It will rupture the capsule. So this is intumescent cataract that will cause shallow anterior chamber. Do a big capsular rhexis and do the hydrodissection tap in the middle. Okay. So this is one conditions. Another is, so this is a mid-dilated pupil. You're not seeing the capsular rhexis margin. Be careful. Just try to identify the rhexis margin and try to put the fluid underneath the rhexis margin. So you have to be a little bit extra careful in this type of patients. Now this is which I got in the literature is a phaco sleeve assisted hydrodissection. So what they have done over here is that they block the main incision site with the phaco sleeve and they don't remove the viscoelastic substances. And the hydrodissection is done from the side port. I usually do from the main port. I don't do from the side port. So this is a steep learning curve. How successful, it's difficult to comment now, but they do in shallow anterior chamber. So the key to successfully completing hydrodissection and cataract surgery in the presence of a shallow anterior chamber is recognizing the problem early. Do a proper preoperative workup, making a correct diagnosis, see if it is not having any zonular lysis, all those other conditions you have to rule out, and you have to recognize the problem early and make a correct diagnosis, thoughtfully assessing one's options. Then you can think what I can do in the table. Okay, so then thereafter proceeding with a suitable management strategy. Thank you so much.